Hi Chelsea, my name's Amber, I'm a student nurse practitioner. I'm going to perform a physical exam on you today.
Okay.
Any specific complaints?
No, just a checkup.
Okay, I'm going to go ahead and start by washing my hands. So the first thing I'm going to do is just check your blood pressure. Twist to there. All right, 110/70, so that's good. And then in 10 minutes, I would go ahead and check the left arm in the same position. So just general appearance, I noticed her skin is pink, warm, and dry. Any suspicious lesions, lumps, bumps, anything like that?
Not that I've noticed.
Okay. So I'm gonna get things started by just assessing your head. I'm gonna just feel here. I don't notice any lumps, bumps. The hair is evenly distributed. So moving on, I am gonna just check your smell real quick, which is cranial nerve number 1, the olfactory. So I'm just going to put something under your nose. I'm gonna have you tell me what it is. Have you had any issues with your smell?
Nope.
Okay, go ahead and close your eyes.
That sounds like rubbing alcohol.
That is correct. So we're gonna assess your eyes next. And cranial nerve number 2, which is the optic nerve, which is for vision. Typically that's checked with the Snellen chart, but we don't have that available here today.
Okay.
So we're gonna move on and check a few other cranial nerves. Any vision, no vision issues?
Just glasses to see far away.
Okay. So I'm gonna check cranial nerve 3, 4, and 6, the ocular, motor, trochlear, and abducens. I'm gonna first just look straight ahead and check your pupillary response if my pen works. Okay, and pupils are equal, round, reactive to light, and accommodation bilaterally. So I'm just gonna test your extraocular movements now. So just follow my finger with just your eyes. Perfect, and then just still follow my finger. Okay, and her pupils constrict when my finger goes in and dilates when it comes back out. So I am going to now check for her red reflex in her right eye, and I'm going to check that from 3 feet away with my right eye. And I can visualize the red reflex. I'm going to just come in closer, take a look. And I do see her optic, disc, cup, macula, and vessels. And then I'm gonna also check the other side with my left.
Am I looking at you or straight ahead?
Just
Straight
just
ahead.
look straight ahead.
Okay, sorry.
And again, I see the red reflex, and I do see her optic, disc, cup, macula, and vessels in the, I guess that was her right eye. Got those switched up, but still the same difference. And then just general appearance, I'm gonna just pull down on your, and have you look up. Her sclera is white, her conjunctiva is pink, and her eyelids are symmetrical. So we're just gonna go ahead and take a look at the ears, and while we're doing that, we'll do cranial nerve number 8, which is the acoustic. So I'm just going to do a whisper test.
Okay.
So I'm going to have you repeat what I say.
Orange, yellow.
Okay.
Orange blue.
Perfect. So first we'll just take a look at the outer external canal, and I don't notice anything on either. No drainage. Have you had any ear pain, anything like that?
Nope.
Any pain when I push on your tragus?
Nope.
All right. So I'm going to assess the inside of her ear by pulling back posteriorly. And I can visualize the tympanic membrane. It's pearly gray. She has a good cone of light. Minimal cerumen there in the external canal. And same with this side. Okay, I can see the tympanic membrane as well here, which is pearly gray. And she has a good cone of light there. So next I'm just gonna look in your nose real quick, just see if there's any issues there, which looks like bilateral nerves are clear, pink, moist. So we're gonna go on with your mouth, and we're just gonna hit on the rest of the cranial nerves. Okay. So cranial nerve number 5 is the trigeminal, so I'm just gonna have you bite down. And she is good. This is just to assess your chewing, biting, and that all appears good and well. Cranial nerve number 7, which is the facial nerve, so I'm gonna have you smile, frown, puff out your cheeks. That was a great frown.
I don't frown much, sorry.
Cranial nerve 7 is intact. And then cranial nerve 9 is the glossopharyngeal. So I'm just gonna have you stick out your tongue. I'm gonna just assess your uvula. Say ah. Okay, uvula is midline, it rises and falls. We can also check her gag reflex, but we typically do not check that in the primary care setting, or if someone's awake alert, we know she has a gag. Cranial nerve number 10 is the vagus nerve, and that is for talking, swallowing, and we know she's been doing this since she's been here. So cranial nerve 11 is the accessory nerve, so I'm just going to have you push against my hand with your neck, turn your head. Oh, other way, and press down. Perfect. And then the final cranial nerve number 12 is the hypoglossal nerve, and I'm just having you stick your tongue out and move it side to side. Perfect. So we're going to take a better look at your mouth. My pen light isn't working, so I'm just going to use this. So just open wide. Lift up your tongue. I'm going to inspect underneath on the side and the upper palate. I don't notice any dental issues. Have you had any issues? No. Mucosa is pink, moist. So next, I think we're just gonna go with the neck exam. And with that, I'm going to first check your carotid pulse, and then we'll go from there. So I'm just gonna assess one side at a time with 2 fingers. She has a good strong pulse there. And then we'll assess for any bruise. And I don't hear anything, no bruise there. Same on the left side. Okay, so her carotid pulse is 2+ bilaterally, no bruise heard. I'm also gonna check her thyroid while we're up in the neck region. I don't notice any masses, nothing like that. Trachea is not deviated. Have you had any issues that you know of, any swelling in the neck? No. Okay, so I'm gonna come behind her and go for her thyroid cartilage, and then just have her swallow. And I can feel the thyroid gland moving up and down. And while we're up here, we're just going to assess your lymph nodes as well. So we're going to do pre and post auricular, occipital, tonsillar, submental, and submandibular. We're also assessing anterior and posterior cervical chain and supra and infraclavicular. If you can shrug your shoulders, you can usually feel the supraclavicular better that way. And I did not appreciate any swelling. Did you have any pain when I just pressed there? Okay. So along with the neck exam, I think we're all done there. So I'm gonna just go ahead and move forward with the lungs. And just noting, she's had non-labored respirations while she's been sitting here. Doesn't appear to be in any acute distress. So I'm gonna listen. First, you can just breathe normal. Actually, I allowed him to have you take a nice deep breath in and out. Okay. Let me get in the back. Okay, and her lung sounds are clear bilaterally with no wheezes, rales, bronchi noted there. So I'm going to go ahead and assess your heart, and we're going to start with the point of maximal impulse, which is located, I'm going to use my palm and locate the fifth intercostal area and just push down. She's just going to take some nice deep breaths, and we're checking for any heaves, any thrills or lifts there. And I don't note anything. I don't note any abnormality there. So I'm going to listen to her first sitting up, and then we'll listen to her again sitting down. First the aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I'll have you lay down for me. And again, listen to the aortic, pulmonic, Erb's point, tricuspid, and mitral. You can go ahead and set up. I could hear all the 5 points. Pulse is regular, no murmurs, no gallops noted there. So while I'm up here, I'm just going to check your radial pulses. And those are 2+ and equal. So now, since we've assessed the lungs and the heart, I would also do a breast exam, which Chelsea says she does routine self-exams at home. Do you have any pain in your breast, lumps, any nipple discharge, anything like that?
No.
Okay. So if I was going to assess her, I would just use a circular motion in 3 different positions. So one where she's sitting with her hands down, hands on the hips, and then hands above her head. So since we're not doing the breast exam, we're going to move on to the abdominal assessment. Gotta love the old school. So I'm going to have you go ahead and lay back. And I noticed when she was sitting up that she didn't have any distension. Abdomen was flat. I noticed here as well. So first I'm going to go ahead and listen in all 4 quadrants for vowel sounds. And vowel sounds are active, normal active in all 4 quadrants. Have you had any belly pain or anything as of late? So I'm going to first start with just light palpation. Any pain there? Anywhere? And then we'll go on to a little deeper palpation. And then we'll also percuss for tympany, and then we can expect dullness on the right side in the hepatic region. And then we can also assess to try to find the edge of the liver. So I'm gonna come on this side and I'm gonna put that in my left hand, and then I'm gonna have you take a nice deep breath in. I'm gonna push up. And I feel the edge of the liver there. And then we could also do the same on the left side to assess her spleen and feel for that. While I'm down here, I'm gonna check fem pulses. So those are equal bilaterally, and then we'd also assess for any inguinal lymph nodes as well. Since I have her laying flat, I am gonna have you bend your legs. I'm just gonna check popliteal pulses as well. And those are 2+ bilaterally. I'm just gonna have you lift this leg up while we have you sitting just to check your range of motion. Good. And on the other. Perfect. And I think that's it while we're laying down. This is like the old school bed. Okay, just thinking out loud. I am going to check her dorsalis pedis pulses. And her posterior tib pulses, which those are both equal and 2+ bilaterally. Now we can go ahead and check her deep tendon reflexes. Once I grab my reflex hammer. So we'll start with your brachial and your bicep and triceps, I should say. So. Okay, we'll check the other side. And we'll check radial. And then we will check the patellar reflex. And the Achilles. Perfect. So now we've discussed pretty much everything, the skin, head to toe. So now we're just going to do some neuro. So I'm going to have you squeeze my hands. Perfect. I'm going to have you just move your fingers, click them together fast. Great. I'm going to have you push down on my feet like you push down with your feet on my hands like you're pressing the gas, pull back. Perfect. And then I'm going to have you put your heel to shin and just, it's kind of awkward sitting up doing it, but okay. And the same with the other side. So I notice all of her movements are symmetrical. There's no weakness noted. She has +5 strength in all 4 extremities. So now have you stand up. We'll have you just go in the corner here and then just walk across the room. Okay. And put your heel to toe. Just walk heel, Okay.
Can I look at?
Yeah.
Okay.
And then on the way back, we'll just have you walk on your tiptoes. Perfect. And then I'm going to just assess a little more range of motion. So I'm going to have you bend down at perfect. Awesome. And then we'll have you just lift your arms out to the side, up above your head. All right. All of that looks good. I didn't notice any abnormalities in the curvature of her spine. I think the exam is complete, but I'm just going to think over real quick if there's anything I'm missing. But I don't think there is. Yeah, I think we're good. We got all the cranial nerves. We did everything. So Thank you so much for letting me do my assessment on you. Have a good day.
Thank you.